We've got a lot to cover. We're going to be talking about dissecting the operative report. So my name is Toni Elhoms. So we're going to talk a bit about the global package. Anytime you're looking at an operative report, and I say operative report, that could mean a surgical operative report, or it could also be a procedure report. But the operative report is a catch-all name that you'll hear frequently. So the global surgical package is a concept that you definitely want to be familiar with anytime you're coding from an op report, because that's going to tell you what can and cannot be reported separately, as well as some of the care that happens before and after the procedure or surgery. We'll also talk about the key components of the operative report. So we're going to go through a full operative report together, and then I'll talk about each section before we get to that example where we actually dissect it together. We'll also talk about some of the most common surgical modifiers that you'll need to be aware of as you're coding operative reports. We're not going to talk about all of them, but we're going to talk about the most commonly reported modifiers. We'll also talk about some strategies that are my favorite in terms of dissecting the operative report so that you can be successful as you're reading through and extracting what's codable. We'll take a look at a sample auditing worksheet, which can be used as a framework if you are auditing operative reports. Auditing an op report is a little bit different than coding an operative report, because oftentimes when you're auditing, the codes have already been submitted. And so it's a different approach as far as what you're looking at and the information that you're collecting. But we'll talk about the differences between abstract coding and auditing once we get to that portion of the session. We'll also go through a few examples together, and then we'll take some questions at the end. So the operative report is the first line of defense when it comes to the coding of the procedure or surgery and the reimbursement. If it didn't happen as far as the documentation in the operative report, then for coding and reporting purposes, it can't be reported. And that's one of the most difficult things to get physicians to understand is that if it's not in the operative report, then it's not billable, it's not codable. Now we're going to go to an extensive operative report. So we've got a spine surgery. Can you guys tell I love to do spine surgeries? They're probably one of the hardest areas for surgical coding, but they're one of my favorites. So we've got our preoperative diagnoses. You'll notice these are the same. Sometimes they're going to be different. Sometimes they're going to be the same. Postoperative diagnoses. So we're looking at herniated disc L4 to S1. So we've got two levels of the spine. Right-sided foraminal disc herniation with stenosis, and then a ganglion on the facet at L4 to L5. The procedures performed. So we've got quite a list here. Remember, this is the wish list. So this is what the surgeon intended to do. So we're looking at a laminectomy, facetectomy, L4 to S1. As well as a discectomy for the interbody fusion. So it looks like it's going to be a transforaminal technique. And then interbody fusion, interbody cages. At both levels, they're going to do an implant, a titanium cage at each level, segmental instrumentation, meaning more than one segment. So we're dealing with L4 to S1, which is two segments bilaterally, and they're going to put pedicle screws as well as pre-contoured rods. So it's going to be a set of 6 screws that are placed on the spine to fuse it together to prevent any type of movement. There's also going to be operative fluoroscopy and autogenous local bone graft, morselized allograft that's consisted of DBM, and then epidural and soft tissue platelet-rich plasma, so a PRP injection, L4 to S1. Anesthesia is going to be general anesthesia, it looks like, as well as Marcaine with epinephrine solution. We've got our EBL of 100 milliliters. There were no drains placed, no complications noted, and no specimens taken.